Presiding Officer, I am very grateful for the opportunity to update Parliament on today's COVID cases and repeat my assessment of what we must do in response to the current situation. 5,951 cases were reported yesterday. 45.4% of cases now show the S gene dropout, indicative of Omicron. It therefore seems likely that by tomorrow Omicron will be the dominant strain circulating in Scotland, and because of its much higher transmissibility, this will drive an even more rapid increase in cases. Omicron is spreading exceptionally fast, much faster than anything experienced so far in the pandemic. I am profoundly concerned by the scale and the immediacy of the challenge it poses. In response, we are already rapidly accelerating delivery of boosters, and we will continue to do so. 59,437 booster or third doses were administered yesterday, a further increase on the day before. But, Presiding Officer, we must understand that Omicron is currently running faster than even the fastest rollout of vaccines. And also a key point that the immune protection from vaccination is not immediate. It takes a few days. So as we speed up vaccines, we must also act to slow this virus down. If we don't, the consequences will be significant. Even if Omicron's impact on individual health is milder than other variants, and let me stress, we have no evidence of that yet, many will still become severely unwell and die, and the sheer number of people infected will present a massive challenge. Indeed, in London, where transmission of Omicron is currently the highest in the UK, hospital admissions are now rising sharply. If we don't act now, what we have feared all along, but so far avoided, the overwhelming of the NHS, could happen. But let me be clear, this is not a choice between protecting health and protecting the economy. A surge in infections will cause, indeed is already causing, staff absences that will also cripple the economy and other critical services. Presiding Officer, this is a really serious situation and we must respond accordingly. I therefore want to strongly underline the advice I gave on Tuesday. Please reduce your contact with people from households other than your own as much as you possibly can. For now, please stay at home much more than you normally would and as much as is feasible. Right now, the risk of getting COVID from interactions with others is high and it is rising. So ask yourself before doing anything you might have planned over the coming days, is it as safe as it needs to be, and is it vital enough to you to justify that risk? I suspect what is most important to most of us over the next couple of weeks is having time with our families at Christmas. Every interaction we have before then increases the risk of us getting COVID and so possibly losing that. More generally, I suspect what matters most to us, and I know this is strongly my view, is protecting children's education. So by acting to reduce community transmission, we will also be helping keep schools open and open safely. Presiding Officer, given what I am being advised about the risk Omicron poses to health and the economy, I would not be fulfilling my duty if I failed to give this advice. I would not be acting in good conscience. However, I am acutely aware of and deeply concerned about the considerable impact of this advice on businesses. Although, let me repeat, businesses will also suffer if we don't act to slow the virus. The fact is, business now needs the type and scale of financial support that was available earlier in the pandemic. However, there are simply no mechanisms available to the devolved administrations to trigger the scale of finance needed to support such schemes. We need the UK Government to act urgently and in the same way some other countries are already doing. I made this point again at a COBRA meeting yesterday, chaired by Michael Gove and attended by the Chief Secretary to the Treasury. But this now needs the urgent engagement of the Prime Minister and the Chancellor. We must not sleepwalk into an emergency that for both health and business will be much greater as a result of inaction than it will be if we act firmly and strongly now.